Sometimes referred to as a silent killer, peripheral arterial disease, or PAD, is one of the most common circulation disorders. Often underreported and frequently not diagnosed until treatment options become more challenging, the consequences of unrecognized and untreated PAD can be serious and life-threatening. Today, what your legs might be telling you. I'm Erica Vetrini on location in Nashville, Tennessee. Access Health starts now. Peripheral arterial disease is a progressive disorder and happens when plaque buildup in the arteries limits oxygen-rich blood flow to the legs, feet, and other arteries that carry blood outside of the heart. Although many people can experience early symptoms, statistics are showing that up to half of people diagnosed don't have any symptoms at all. Unfortunately, many cases of PAD are frequently diagnosed after permanent damage has occurred, putting both symptomatic and asymptomatic patients at significant risk for heart attack, stroke, and even loss of a limb or death.
I didn't want him to cut my leg off, but I had gangrene. You either get it removed or you die, and I didn't want to die.
Everything that I read was happening to me. Started looking at the causes, and I'd lived all the causes, and now I was living the symptoms.
I recently heard about innovations in the diagnosis, assessment, and management of PAD, so I'm here in Nashville to find out more from vascular surgeon Dr. Brian Fisher at the Surgical Clinic. So doctor, as a vascular surgeon, you've been working with PAD patients for a long time. Can you describe what PAD is?
PAD is caused from plaque that narrows blood vessels throughout the arteries or the blood vessels that carry oxygen throughout the body. Whenever that narrowing or blockage becomes bad enough, we notice symptoms and you start to get damage to the end organ or whatever is supposed to be getting blood flow from that particular vessel. Peripheral arterial disease affects what happens in the kidneys, what happens in the blood vessels going to the brain, and also to the lower extremities.
Tell us exactly who is at risk.
There are several risk factors, including age, diabetes, family history, which is a very important risk factor that you can't really modify, cigarette use, hypertension, and hyperlipidemia. In other words, elevated cholesterol levels.
So there's a lot of people that fall into those categories.
There are a lot of folks that fall into those categories, and unfortunately, I think that 20 million number doesn't begin to scratch the surface on all the people that actually have the disease.
So that's a large group of people that are at risk. What are some of the symptoms that show themselves?
And some of the symptoms are very straightforward and others are not. The first thing that we look for in these patients, again, because the symptoms can be very subtle, is even just coolness in the extremities. Okay? The next thing that we tend to look for is fatigue or the patient feeling tired whenever they walk. Many people they ascribe this to being old, right, with old age. And it actually can mean that there are blockages in those blood vessels trying to supply oxygen to those muscles.
And is it progressive? Are these symptoms progressive?
Well, it depends. If you continue to have some of those risk factors and don't choose to modify those, this is a progressive disease. And unfortunately, most patients don't have their risk factors modified in an aggressive manner. And those are the folks that go on to progress to or chronic limb-threatening ischemia. And that's considered the worst case scenario of peripheral vascular disease and the one that we're most concerned about.
So doctor, what is the end results for patients that go undiagnosed and untreated?
For the best case scenario, often, again, these folks, if they have peripheral arterial disease, they're at risk of having blocked arteries throughout their body. And we know that most of these people will go on to potentially have a heart attack or have other coronary issues. Finally, we know that if you have the worst case scenario and the patient has exhausted all their treatment options, amputation comes into play and becomes a possibility for treatment.
Amputation as a way to extend their lives?
Actually, that may be a little bit of misinformation. We know that in the immediate effect, if someone comes in and they have, let's say, gangrene of their foot and they undergo an amputation immediately, that is a life-saving operation, and those patients do well in the early perioperative period. So roughly 50% will die at 2 years, and then we know more than 90% are dead at 5 years, which should get everyone's attention.
So things are clearly not where they should be, doctor. What are sort of your hopes for the future?
My hope is that not only from a healthcare standpoint, we put more of an emphasis on recognizing and diagnosing patients early on in the peripheral arterial disease spectrum so that we can start to modify their risk factors. Plenty of things that we can do that will actually slow the progression of peripheral arterial disease and minimize the risk of amputation ultimately. I will say too that if you're one of those patients that presents later on in the course and you hear the words that you need an amputation, it's very important and incumbent upon the patient to try to get a second opinion, to make sure that an actual workup has been done to make sure that there's blood flow going to the extremity and that it'll actually heal.
Because likely there are other options.
There are often many other options.
More of my visit with Dr. Fisher later in the show. After the break, taking steps towards earlier diagnosis and improved management of PAD. According to the National Institutes of Health, over 1 million people in the United States have lost a limb due to vascular disease, including diabetes, PAD, and critical limb ischemia, and the numbers are predicted to double over the next 30 years.
I started out with diabetes about 15 years ago. I didn't know really what it was. They put me on some pills. Later on the years, they took me off the pills and started me on insulin. I kept on eating what I want to eat, and my sugar just kept going up and up. I worked at a school in the cafeteria, and you know, you do a lot of walking, and sometimes it affected my legs at work because my legs would get tired, and I couldn't hardly walk, and I had to, sneak and sit down. And that's when I knew then something wasn't too right with my legs because they ain't got no business being tired like this. My feet were so sore I couldn't hardly walk on them. I went to the doctor and he was telling me that I had an infection and it was going up, and what it was gangrene had got caught in my leg and my feet. And the doctor said that they had to remove my leg. The following year, I had to get my toes amputated. I was really angry with myself because for the simple reason I didn't take better care of myself. Sometimes we can take things for granted, and before we realize it, it's too late to do anything about it.
The incidence of PAD is on the rise, and the need for improvements in early detection, amputation prevention, and management strategies are more critical than ever. Podiatrist Dr. Day frequently sees many of these at-risk patients.
A podiatrist as part of the team is critical. We're there to provide preventative care or even treatment of complications that may have developed in the course of time with these patients. Our goal ultimately is to prevent amputation. The patient's responsibility in that goal is to exercise good judgment, and also if we've done our job well, we've educated them on what to look for. They participate in examining their feet every day and then notifying us quickly that they need to be seen so that we can also evaluate them. It's important that we ask the right questions. We need to find out from them, are they having any symptoms that maybe they are not paying attention to? We'll do a general exam looking at the color of the skin, the temperature of the skin, and any types of wounds or color changes that may be present that may be indicating a change in blood flow. We're going to assess their vascular status. That means palpating pulses, very similar to taking your pulse on your wrist. We're going to evaluate ankle brachial index, which is referred to as ABI. And that's basically the blood pressure of the foot. And that will give us a good indication of how well perfused or how well the blood supply is to the foot. If we've evaluated a patient and we've identified that they may have clear vascular disease, it is our responsibility to take the next step and refer that patient.
Before I retired is when I really started having some problems. At least started to realize that I had problems. We were always told, you know, to suck it up and drive on, that it would get better, and it's just part of military life. And that's the way my mind was ingrained. You know, I lived with this for a long, long time. The burning, the aching in the legs, the swelling. Still thinking, the mind thought back then was, you don't go to the doc. You just don't do that. We got stuff to do. You didn't have time to worry about aches and pains. I lived with that for about 10 years, and finally, just couldn't take it anymore. So that's when I said, it's time for me to go, because I can't stand the pain. It's just, it's too much, and there's too many great soldiers that I've been training that can take my place and not back up any at all. But I did go to the VA, got a PCM, a primary care manager assigned to me, and that's the one time in my life where I actually spilled my guts, swallowed my ego, and said, you know, there's something wrong with you. When he said I had PAD, I really didn't understand. He said it was kind of like driving through a tunnel in your car, and as the further you went, the tunnel got smaller. And he said that's what's happening with your arteries. It's going to eventually get to a place where it can't go anywhere. They're blood clots, is what it amounts to. And if you can't get blood to your legs, it's going to affect everything in your legs. It could move to your heart. It could move to your brain. It could do a lot of things, and that's kind of what got my attention and got me to thinking about it. That, you know, I'm 70 years old, and when the man calls, I'm gone. But I could extend my life, and that's what the doctors tell me. That if you'll quit smoking, if you'll slow down on your beer drinking and do all of that stuff that I enjoy doing, you can extend your life. You know, maybe if I do something right, maybe I can feel a little bit better. Maybe I can walk those steps again. Maybe I can walk without having to stop and let my legs get better.
Welcome back. The incidence of PAD is on the rise, and the need for improvement of early detection, amputation prevention, and management strategies are more critical than ever. Back at the surgical clinic in Nashville, Dr. Fisher and his team are devoted to providing improved access to patients.
Well, here we are at the Vascular Procedure Center in our office, where we provide the minimally invasive care for PAD.
So what are the types of treatments that you perform here?
So there are several. One, diagnostic studies. The next is arteriograms. The third is angioplasty, where a balloon is used to push the contents to the side. And then finally, stenting is done as well. And that's where we place scaffolding that helps to move that material to the side and restore blood flow to the blood vessels.
So tell me about the technology and the tools that you use to perform these treatments.
We have some great tools, and imaging plays a key role in a lot of what we do. From the basic standpoint, we have fluoroscopy. This is where we inject a dye into the blood vessel. You can see it's normal. You can see the blood vessel is normal here. But when you get to below here, you can see where that narrowing is.
I can see that, yeah.
Then we have the additional modality of intravascular ultrasound, which is absolutely much more accurate at determining the narrowing of the vessel and also sizing the vessel
Am
itself.
I looking into the vessel right now?
You are. It's a very
That's
cool
incredible.
view.
Very cool. And so this gives you exactly what you need in order to perform.
These are the tools that we use to perform these procedures both safely and effectively.
So there really is, with all of this, there really is no need to go directly to amputation.
Well, that's just the idea,
Yeah.
is that we want to eliminate that third of patients that undergo an amputation without any vascular workup. And we want to eliminate that completely.
So doctor, tell me how you think office-based labs like this one are really helping your patients.
As far as office-based labs are concerned, we know that this provides access to patients that they otherwise might not have. These are fairly mobile in that you can place them out in the community and they can be closer to home. And we also know that we have some advantages as far as wait times and things like that when it comes to comparing to the hospital. You don't have to go on campus. The parking is very simple, and the wait times are fairly short.
Which matters to someone who's sick and who's in pain and who's hurting.
It absolutely matters.
So, doctor, I know you're very passionate about the way patients that have PAD are being treated. How do you think these office-based labs are helping your patient?
I want patients to feel empowered. I want them to ask the right questions and know that when they start showing signs and symptoms, to see their primary care doctor, to work on a referral to a podiatrist, to get a further workup, and then be able to navigate to the appropriate specialist, the board-certified interventionist, to provide the appropriate treatment for that patient. And again, all this with the patient in mind is that we know whenever we save limbs and we avoid amputations, we save lives. And what could be better than that?
Welcome back. As we've seen today, the tools and technologies are continuing to evolve in the management of peripheral arterial disease. The question is, how are these options helping patients?
But I met Dr. Fisher at the wound center. He started taking care of me, and he was my doctor ever since 8 years ago. I see him every 3 months. They do an ultrasound on my left leg. If they see anything, they'll let him know, and then he'll let me know if he have to go in to let my blood flow in my leg to my foot. It makes my leg feel a whole lot better than what it was. And I'm glad to be alive, because it was 2 or 3 times I could have died. But I'm thankful that I am alive and doing great. Just being in the world, being in the land of the living.
When I went in to see my PCM at the VA, I explained some of the pain that I was having. She gave me a referral for some tests to be run. When the test came back, it was PAD. My arteries were clogging, and that's when I was referred to a vascular doctor who I've had probably 3 surgeries with him, 1 bypass, a couple of stents, and remarkably, I thought I was going to be laid up for a while. Well, that didn't happen. As I asked him, I said, when can I start doing stuff again? He said, as soon as you leave this office. That was remarkable to me. I know I'm better, and that's the end result of me going to see the doctor to get whatever it is with me, get me fixed up so I can have some sort of quality of life for the rest of my life. I guess one thing that I'm not real proud of is when I was hurting, I kept it to myself. Maybe it was because of fear of the unknown. Maybe it was fear of what I thought they may find. And now that I realize that I wished I had, I want to make sure that everybody understands that there's no shame in saying you're hurt. Get it looked at, get it taken care of, and your life will be much better, and it'll be much better much sooner.
The incidence of PAD is on the rise, but fortunately, technology exists to better treat patients. As we heard today, the answer lies in awareness, early diagnosis, and a multidisciplinary approach. I'd like to thank Dr. Fisher and the patients for their insight. If you'd like more information on today's episode or to find a treating physician near you, head to padandme.com, or as always, you can head to our website at accesshealth.tv. See you next time.